Hi everybody, this is Dr. Blevins with Enilda Clinic. It has been a couple of weeks since I've done a live video. I took some time off to have some rest and relaxation, and I'm super excited to be back. Today I'm going to chat about the one thing that I really want parents to know, and that is that your kid does not have to have a diagnosis for you to reach out for support. So sometimes whenever I'm chatting with parents just in my personal life, they feel like the problem that they're having with their kid, whatever it is, doesn't warrant getting support. Praise your kid. Oh, I love that Bree said that. I'll tell you why Bree's saying that, because I applied to do a TEDx talk, and the title is Praise is the New Discipline, which I hope that they accept it, but I don't know, maybe they'll think it's stupid and they won't accept it. But yeah, praise is really good too. But no, the thing that I'm talking about today is that you don't have to, like, your kid's difficulty doesn't have to be so big that you think, oh no, I think they have ADHD, I think they're depressed, I think they have depression, or I think that they have a reading disorder or dyslexia or whatever. It doesn't have to be diagnosable. In fact, it's so much better, easier, more efficient, and more effective to support a child whenever a problem first appears before it becomes super entrenched, whether it's a learning difficulty, an emotion regulation difficulty, a mood difficulty, whatever it may be. Even things like autism, language disorders, treating them younger whenever you're first noticing a difficulty is super, super important. And so I want to just validate parents out there that if you're experiencing difficulty with your kid and you're thinking, is this important enough to go chat with a specialist? Don't worry about that. Like, I have people who come see me for just one session just to chat through a problem, and it's not with the intention that they're going to be in therapy or their kid's going to be in therapy for the next 6 months, but it's with the intention that they want to make sure that they're doing the steps that is in their child's best interest to, remediate that difficulty, get rid of that problem as easily and quickly as they can. One of the things that I will hear from parents is they do bring up these difficulties with their child's pediatrician, but sometimes they feel like they don't get a response back. And so what I want to encourage you in those situations is that if you're feeling like you don't know what to do after that step and that you're still just kind of waiting and seeing what will happen, be very specific with your child's pediatrician and say, I want to know what I do today to support my kid with blank. And if your child's pediatrician, they might not know exactly what to do because it might not rise to the level of a diagnosis. And so if it's something where it's just the beginning little tiny inklings of a difficulty, it might be that you just go see a behavior therapist, or you just schedule a conference with your child's teacher and the behavior specialist there at the school, or whatever it may be, right? Just so that you can do a couple of little tweaks way before you have to do this big overhaul of things happening in your kid's life. All right, everybody, I'm so glad to be back and chatting with you, and I'll be back next week too, so please be sure to post any questions that you have, and I will be super happy to answer them to the best of my ability. All right, bye everyone.